around best practice in health preference research. This is a collaboration between the International Health Economics Association Health Preference Research Special Interest Group, who I represent. It's a collaboration with the International Academy of Health Preference Research. So Jenny, one of our speakers today, is on the board of that, and it's with the Patient Journal. So it's great to see Chris join. Thank you, Chris, for your support in getting these papers out. I'm not going to talk too much, but just to emphasize that we've got 2 more webinars this year, and we've got the possibility of a 5th. So with that teaser, I will share more details afterwards. But we've got Axel and Co coming on the 21st to talk about decision objects. We've got Deborah and Co coming in December to talk about stated preference survey design. But I'm going to hand over to Jenny, Richard, and Kirsten. It's great that we've been able to get this organised at an Australian-friendly time zone. Sorry to the folks in the US who are either up at 3 a.m. or are watching on YouTube. So it's great to have you if you're doing so. I will hand over to Jenny to take it away, I think.
Thank you, Matt. Thank you. Well, welcome everyone. We are going to talk today about give a webinar on one of the papers from the series that was authored by Kirsten, Richard, Emily and Ellie and myself on putting the choice in choice tasks, incorporating preference elicitation tasks in health preference research. So we're really going to think for the next hour about how to design your choice task and present it in a preference survey. So I'd like to introduce first of all the speakers that we've got today. So and I will acknowledge, of course, our other co-authors, Emily and Ellie, who were unable to join today to speak. But let me introduce first of all myself. Obviously, I'm from Evadera. Richard, I'll hand over to you next just to say hello.
Thanks, Jenny. Hi, everybody. Richard Lorenzo. I'm from the Centre for Health Economics Research and Evaluation at UTS in Sydney, a mouthful. And look, I found a razor.
And Kirsten.
Hi, everyone. Kirsten Howard. I'm from the Menzies Centre for Health Policy and Economics at the University of Sydney. Thanks for coming today.
Great. So next slide, please, Matt. So what we're going to do today is we're going to talk a little bit about the material that's covered by the paper that you can all hopefully access and read it if you're interested in further information. And I just thought I'd draw out the key learnings of the paper. So the key things that we're really trying to understand from some of the things that we all think about today are that the design and setup of choice tasks in a choice experiment should mimic the real world of interest. If the choice experiment, or commonly it's a discrete choice experiment, is to be able to validly and accurately predict the actual decision behaviour of and represent a wider group of individuals who the respondent answering the survey represent their preferences. And to achieve this, it's important to understand the implications of the options available to the researcher, considering in particular the following steps that we're going to talk about a bit today during our conversation. So the context of the choice, the size of the choice set and how it's composed, such as things like whether you've got labelled or unlabelled alternatives, whether there's an opt-out alternative included, and the format of the choice question. So for example, are you asking about just the most preferred or the most and least and so forth. So that's a sort of material we're going to talk about today, and hopefully we would really like to invite your thoughts and comment on this as well, as we were talking earlier, either in the chat as we go, or I'm hoping we'll have some time at the end for some questions. We should have quite a reasonable amount of time to have a discussion on questions around this. So please do sort of think about questions or think about things that you want to sort of add as we go. Next slide, please, Matt. So Richard and Kirsten and I put our head together and thought about how will we do this seminar, and we thought we might do something a little bit different. So we thought rather than having a seminar consisting of sort of presenting slides, we would have use a hypothetical example, and we're going to have a conversation around some of the issues that are here. So Richard, Kirsten and I will have a conversation, and we welcome your thoughts, your additions. If you pop them in the chat, we'll see them, or at the end, of course, we can have hopefully a good discussion around this. So we've got an example that we're going to use in our our conversation to draw on, and that perhaps we can hopefully all relate to. So we thought we'd talk about which which person you'd prefer to be your head of state. And we came up with a list of potential attributes and levels that might be relevant if you were being asked about which head of state you would prefer to have. And then if you go to the next slide, imagine that you've done your lit review and you've come up with this, and your qualitative work, and you've come up with this list. And then we've put it together in just an example choice task that might be the case for this. And what we're going to have a conversation around is things you might consider when you're thinking about how to present this choice task, and the text and the information and the context that goes alongside the choice with that choice task. So that's what we're going to have a conversation about. So without further ado, I think, Matt, if you could just leave this slide for us while we have the conversation so we can refer to it. I'm going to sort of throw out a question so we can start the conversation to Kirsten. So Kirsten, I wondered, what's the first thing that you think of when designing a preference elicitation task like the one that we have in your example? What sort of thing comes to mind first?
I guess from my experience, one of the most important things that we need to think about is that we want to be able to actually say that the results from our stated preference, our DCE, are going to predict preferences for the actual question of interest. So, the question, I think, really needs to be framed in a way that accurately reflects the reality of that choice situation as closely as possible, so that when we get the results of our choice task, that we can be reasonably assured that people's stated preferences are actually going to be pretty close as possible to what people's real choices would be in that actual situation. I think the other thing is that it really needs to sort of accurately present a real world choice if you're going to use the DCE to then predict the decision behaviour of a wider group of individuals. And you've already kind of mentioned this, Jenny, in the intro, but if we want to be able to say something about a group of respondents who are wider than the people that actually undertook the choice task, then that real world choice needs to be as accurately presented as possible, I think.
Okay. And are there any other reasons, do you think, why we need the task to be realistic? Is there anything else that you can think of?
I think there's probably a couple of other things that I would think of in terms of sort of the task needing to be realistic. I think one of the other things I usually think about is the fact that if it doesn't reflect reality, or if it doesn't reflect people's real world experience, then respondents may not actually take it seriously and can either disengage from answering the questions or just kind of put in random responses, which is not going to be great for trying to actually look at people's preferences. So I think how you describe the choice question, including things like the question preamble, is really important, and it can really influence how people perceive the legitimacy of the choices that you're asking people to complete. And that obviously, that perceived legitimacy obviously flows through to then whether people are actually going to take your choice question seriously. And that in turn influences the validity of the results you get out the end of it as well. And I think we'll talk a little bit more later on in the session about engagement too. So I think in this example of an election choice, I think how you describe the choice is possibly going to be quite different depending on, for example, where you live. Electoral systems are quite different across different countries, for example.
Great. Does that mean that we need to modify not just the task, or modify a task rather, not only to reflect the choice, but also the relevant context that we're talking about?
Yeah, I think that's right. So I think, for example, I really do think you would want to consider whether For example, using this election example, whether the election is at a national, state or local government level, for example, and whether those levels of government are actually relevant to your particular context. In Australia, they are, but they might not be everywhere. And here you've already said that what we're talking about is an election for a head of state. So this is a national government. But I think you also need to be sort of thinking about and explaining the choice task in how that decision for a head of state is actually captured in your electoral system that you're actually working in. So for example, how does your electoral system work in and of itself is going to be an important sort of contextual factor that helps with the legitimacy of the task and like making it a realistic choice task. So do you vote directly for an individual person, or do you vote for a party who is led by a particular person, or is it something completely different? So I think all of that kind of context is actually really important for making sure that the choice task is as real as possible to people.
Yeah, that's very interesting. Yeah. Do we need to think about how we present the choices? Does that affect people's reality?
Yeah, I think it does. And just kind of sticking with this sort of voting example, I think one thing that you could think about in this context is whether it's a forced choice or whether you're presenting a choice with, for example, an opt-out alternative. And so in this example, how you frame that choice task might actually depend on the kind of voting system you have in your country. So in Australia, for example, we have a compulsory voting system. So an opt-out alternative of not picking anyone is probably not going to be realistic because we are by law forced to vote. But in other countries like the US, for example, where voting is optional, an opt-out where you don't have to vote for anyone might be a perfectly realistic and reasonable way of presenting the choice task. And thinking about that in those different contexts would probably enhance that perceived reality of the choice task that you're asking people to complete.
Thanks, Kirsten and Jenny. I wanted to come in here, but I just noticed that Brigitte's popped up on screen. I didn't know if Brigitte wanted to come in on this conversation before I throw in a little bit of a curveball for a second.
No. Well, thank you for noticing. No, I just thought, well, it would be nicer if you could speak, but
excellent. No, I didn't mean to put you on spot.
Yeah, but I do have a question, although I'm not quite sure whether it's directly related to this, but yes, I do understand that the research questions should reflect real world as closely as possible. But what I noticed in practice, that often it's always difficult for a certain population to fill in that DCE. And what I want to say by that is you try to make the choice task as how do you say it, as clear as possible, and also that it reflects the real world question as good as possible. But still, sometimes I feel that I'm measuring the preference of a privileged few, let me put it that way, perhaps often the more higher educated people. So that would be my question. How do you, how do you take that into consideration when you design the choice task? Because I thought here, I work in the hospital. I also, now we want to involve communication just to make sure that the semantics of the choice task is as clear as possible and will appeal to everyone so that everyone understands the choice task.
Yeah.
But what is who wants in on that? I think we all have some thoughts, but Jenny, did you want in on that first?
No, I just think that's a really good point that you raise, and thinking about how you're, the language you're using and how you're framing the task in a way that's accessible. And I think we will touch a little bit on some of those issues later on in our conversation, but thinking about it being accessible to a wider population, I think that's a challenge that everybody faces. In general, when you do preference studies, it's quite common that you get a population responding that is more educated than the average, and there's elements there of how you reach the right population as well. But I don't know if Richard or Kirsten have anything to add to that.
Yeah, Kirsten, did you have any thoughts? I've got a couple of comments.
I guess apart from to agree with you, yes, that I think that is a genuine issue, and I think there's always this sort of tension between simplicity to ensure people can understand it, and the most people can understand it with that reality of the choice task as well, and really getting a balance in there too. I think some of the things that we might talk a little bit about later, sort of in how they're presented, or maybe you could think about splitting a choice task into smaller ones or smaller number of scenarios, or there's potential workarounds, but I agree that it is a challenge, definitely. So no answers, but just an agreement. So
I think we're all very strongly in agreement about the importance of getting those words right, and ensuring that we are cognizant of pitching the words at a level that will be as accessible to the majority of the population as possible up front. And that can only be done by a process of testing those words through a number of steps up front. The other thing that I've found quite helpful in a number of surveys, Brigitte, is to actually collect some information about readability and about people's comfort with health literacy. So that then when you're analysing the data, we're not just inferring what higher education means in terms of that comfort with literacy. I think we often do that. We often infer that, a high level of education means a high level of health literacy and understanding, but rather, actually asking specific questions about health literacy and literacy around the specific concepts that we're interested in. That can give us a better picture of how we've been able to reach the people that we might be interested in, or how representative the sample is in terms of that broader population. Whether they then become some analysis variables or subgroups that we might think about is a different question. That depends on our sample and our design, and that's a whole other survey, a whole other seminar. But they're all things we can think about. I hope that helped.
Okay.
And there are some really nice short health literacy questionnaires that are not very burdensome for people to complete as well, which can give you a really simple and nice indication of that as well.
Yeah. I do want to stay with this topic, though, about ensuring that what we're doing is realistic, and we've been talking about, the context. But what about if we're thinking about the choice task itself and those alternatives that we're going to present to be considered? If we're going to be putting together the choice task and we're thinking about, the preferences that we're going to ask people to choose between in terms of this head of state example, what are you going to think about first, Jenny? What are some of the things you're going to be thinking about?
Yeah, well, I think one thing that I'd think of early on is whether to present the alternatives in the task as a labelled or unlabelled alternatives in the task. And we also call unlabelled alternatives generic alternatives sometimes as well. So if you've got an alternative that's labelled, then in some way they're informative. So you'll get, in our example, for instance, we could label the heads of state being considered, for example, in the UK, you could label them by the political parties, Conservative candidate, Labour candidate, for example. But that gives some information. It's informative in itself about those different alternatives. In a health context, labelled alternatives might include things like medicine names or specific test names or types of treatment like surgery and medication, as opposed to just saying treatment A, treatment B. And giving the alternatives a label can be helpful because it can make the choice task more realistic, and this can help to improve respondent engagement and respondent understanding of the task as well, and consequently give you better data, improve the validity of your results. However, you also have to consider, as I said, that the labels convey information about the alternatives themselves that's not already captured in the attributes and the levels. So the interpretation of and preference for the label, if you label it, may differ over your different respondents in a way that you as the researcher may not be able to disentangle from when you analyse the preference data. So in health, I think most preference studies have used unlabeled or generic alternatives. So for example, here we've got head of state A, head of state B, that is a generic or unlabeled alternative. And unlabeled alternatives are appropriate if the focus is solely on the attributes, I think. In our head of state example, I personally would use unlabeled alternatives as people's familiarity with named candidates or with political parties might strongly drive the choice beyond the information that's included on the attributes, based on their prior knowledge of the political party that you're naming, for example. If the political party is an important driver of choice of head of state, beyond the attributes that you've already got in, then it should be considered as an attribute.
And so I think, we've made that decision about labelled or unlabelled is something that we need to make quite early up front, because that's going to influence what we do. How do we then move to that decision about how many things we show, how many options or alternatives, as we typically refer to them, how many alternatives we show in a choice set to the respondents?
Yeah, that's a really good question. I think there's many different considerations here, such as the choice context that we've got and how many people you have available to in your sample to undertake the preference survey. And it's also important, of course, to consider the burden on the participants that are completing the survey. In some choice tasks, respondents may be shown a single alternative and asked if they would choose or accept that alternative in a yes-no dichotomous choice. In our example, this would mean showing respondents just one head of state profile at a time and asking if they would vote for this person as their head of state or not, yes or no. If you only show one profile, researchers and respondents would need to know what the non-choice or non-acceptance means for people. So in the head of state example, we wouldn't know this. If you don't vote for this head of state, who would you be voting in, or what would you be doing? More often, the focus of preference studies, particularly in health, is on problems that involve choices among many alternatives. And in this case, you'd show two or more alternatives in the choice task and ask which alternative is preferred. And if you increase the number of alternatives in each choice task, it'll give you more information, obviously, about people's preferences. But the inclusion of more alternatives also has a downside. Because it means that people need to consider more information in each choice task that you give them, making it harder for them to choose, and that could affect the the consistency of the choices that people make. So in our head of state example, assuming that you have a large sample that might complete the survey, which is probably a public survey, so in this case you may well do, I would likely include only two alternatives in each choice task to reduce burden and make it easier for people to complete the tasks. But if the available sample size is relatively small, which we often find is the case in health studies when we're often doing preference studies with patients, then we might consider including three or more alternatives. And in that case, we might also consider using a best worst or a best choice format, for example, to increase the amount of information we get from each choice task that we show to people, and therefore increase the precision of our preference estimates. So I'm just thinking, Kirsten, actually, we talked about the number of alternatives in a choice task. I wondered what you think about the ideal number of choice tasks in a DCE itself or in a preference study itself.
Like asking how long is a piece of string, isn't it? So I think this decision about how many choice tasks really needs us as researchers and people designing these kind of surveys to consider that sort of trade-off between including enough tasks so that you actually achieve statistical efficiency or robust and precise estimates, but also then keeping the response burden manageable for participants as well. And I think there is a real sort of trade-off there. You don't want to have so many choice tasks that you end up with significant responder fatigue by the end of them. So often in health, in DCEs, they've included sort of 9 to 16-ish choice tasks per participant. Some have included as many as 24 or 32, although I think these days that would probably be considered a bit too many. But I think you also need to think about the complexity of each individual choice task and how many people can reasonably complete as well. So I guess sometimes the type of participants that you might have in a DCE, and this is particularly relevant in health, I think, where we might be dealing with patients, we might be dealing with older people, we might be dealing with people who don't necessarily have great health literacy, as Richard's already kind of talked about. And so the type of participants you're expecting is really going to impact on how many choice tasks people can reasonably complete, I think. So for a DCE with older people, for example, with heart failure, participants might only be able to manage 6 choice tasks reasonably and still be giving you decent information. Whereas I guess if you're sort of thinking about participants who are healthy members of the general public, they might be able to complete 12 or 15 or 16 choice tasks for a decision that they're pretty familiar with. So I don't know, something like a study of vaccine preferences or something like that. And I think you really need to be testing this in pilot testing to really make sure that people are actually able to complete the number of choice tasks that you're giving them, because you really don't want to end up with a situation where too many choice tasks is going to affect people's engagement towards the end of the survey, because you really want to be avoiding that kind of situation where you have significant responder fatigue, I think. So Jenny previously mentioned best, worst and best formats earlier. So there've been some recent studies that have compared these different kind of approaches to stated preference studies. Richard, just going back to you, what would you say a researcher needs to consider if you're thinking about using those different approaches? So something like a best, worst or a best choice format.
Yeah, good question. And I'm just reflecting on the comment that Fern's put in the chat. And I might come back to you at the end, Fern, because it would be really great to get you to elaborate on what you've popped into the chat there. But prima facie, I mean, we know that the most common format that we use is the DCE, you know, the comparative, the comparison of choice sets, or the comparative single choice format, to choose the best or most preferred between alternatives. And that can be thought of as having good external validity. That's debatable, and people are looking into that. And we think that it's got good validity because all of us in our everyday lives are very familiar with making choices between alternatives. We do it all the time. When we go shopping, when we go to work, we do it constantly. But as Jenny said, that there are good efficiencies to be gained from asking individuals to give us a full preference ordering. By that, I mean is give us a full ranking of the options or alternatives that we might show them in a choice set, where we have 3 or more alternatives within a choice set. And one way to do that, and Jenny's alluded to this, is through the use of best worst DCEs or alternative bests, and we'll talk about that a bit more. And in a best worst, where we've got 3 alternatives, we're asking respondents to select the best alternative, and then we ask them to choose the worst alternative once we've removed that alternative that they had already selected as best. So you know, they choose one, and then of the remaining 2, they choose the worst. And so people have to consider all the alternatives, and that allows us to gives us that full ranking of their preferences. across the alternatives in each choice set. Gives us more information, greater efficiency, but with relatively low participant burden.
But
Fern, before we move on, I wondered whether Fern wants to give us some of the insights that you've alluded to in your comment there, Fern. Fern may not have a workable mic, so you can just put in the chat no, Fern, if that's.
Sorry,
or we can come back at the end.
I was trying to get into work rather than be at home, but I'm on my phone.
No.
So, I'm
it's
here.
All good.
So yes, I appreciate the comment about reaching only certain populations, and I think there is a concern about that, and I think maybe it's worthy of a separate discussion almost. But I think there is experience of doing DCEs among populations that we would expect could be have great challenges with success. But within that, of course, there's also diversity. You don't just have a vulnerable population, right? Within that, there's great diversity, and exploring who you're not able to capture may be absolutely crucial, because it may be the group that you're most interested in. So in our case, we just had an example of migrants along the Latin American corridor, migrant corridor, where it worked really well, except the fact that there was a small, what you call junk class, which is very derogatory, but actually where we had no preferences that came up, but they were the ones that were most vulnerable and actually most in need of HIV prevention. So this is where we then were able to identify that the DC is not capturing those. So for the bulk of people, yes, we can design tailored services, but we definitely needed an alternative approach. And so it was a really good point. Sorry, I don't remember who made that point, but it is crucial to think about who is being able to respond and who's not. With confidence that for the bulk of people across huge different life cycles, it does work. But there will be some that may not be suitable.
And can I just ask, were you also suggesting that in some of those groups it might be necessary to use a different elicitation task rather than our traditional, one choice DCE? Yeah,
it might be a different elicitation. It might be more qualitative research. I think focus groups might be the more suitable approach, where you actually get people to focus and are having a conversation, because they're moving a lot. They have lots of stuff on their minds, and sitting down and doing a dry task is probably not the most suitable approach. Yeah. Thank you. Sorry about that for taking a while. Thanks.
That's great. Thank you.
No, absolutely. Great input. Thank you. So just going back to what you were saying, Richard, about best worst, and isn't that really kind of asking participants to sort of have two different ways of thinking? So sort of a shift from thinking about best to thinking about worst.
Yeah, it in a way, yes, it is, because it's not how we usually think, right? We don't usually kind of choose which one of these is the best and then flip our minds around and think, now which one is the worst? And so cognitively it does require that respondents change the mental task from thinking about things framed as the best to then thinking about things framed as the worst. And that has been presented as a bit of a challenge or a possible limitation of how we're asking respondents to think about these best worst tasks. And so, that's been modified by some to present these tasks as best. So in a task where we have 3 alternatives, for example, we would choose the best, remove that alternative, and then of the remaining 2, we would choose the next best. So that we're still achieving that full preference ordering. We get the same amount of information about the ordering of that preference task, but we're not asking the respondents to change how they're making the decision. They're sticking with one single frame of thinking about things in the best, in that best frame, and not asking them to then shift and think about the worst.
Yep, that's a really good point. So, opening it up, which one do we think is best? Traditional DCE, best worst DCE, or best DCE? Any takers for that one? Jenny, maybe
I can jump in on that one. Well, I recently read a study actually by Sarah Hulls and her colleagues in which they reported on a head-to-head comparison between best worst and best DCEs, and they conclude and actually rating as well. But they concluded that both preference best and best worst DCEs, both of those methods, improve efficiency of data collection relative to using first choices only from a statistical efficiency perspective. But they found differences in the preferences between the first choice and the second choices in those cases. Nonetheless, they found that best performed overall better than best worst DCEs. So to answer your question, the available sample size, I think, will come in here. We've mentioned that before, but it'll be a really key consideration here, because I think best, worst, or indeed ranking, which we haven't talked about, DCEs, are only potentially beneficial if precision is a concern. Because if you've got a big enough sample size, you don't need to go down that route. But if you do have small sample sizes and precision is a concern, then you could consider going down that route. And in that case, the recent evidence suggests maybe best might perform better than best worst. But in our head of state example, I think assuming that you can reach a large population, we wouldn't need to go down that route. We could just use a single best format, which is the most commonly applied still, I think, in a health context. So having jumped in there, Kirsten, Kirsten raised an important point on engagement before, I think. So I think thinking about how to engage participants is really important in the tasks. So what other ways can we help to engage participants in the choice task, do you think? And maybe Richard, you could say something on this.
Yeah, thanks, Jenny. And this is bringing us back to that really great question that Ian asked earlier, and I'll show you how I've segued to that in a minute. I always like to think about this as, getting people engaged in the DCE is a bit like telling them a story. How you start off really matters, and you need to give them enough information that it piques their interest. You don't want to overwhelm them so they're bored within the first 2 paragraphs, but you also want to give them enough information that they not only understand what they're being asked to do, but that it describes the choice context in the same way for everybody. And what I mean by that is, as much as possible, we want people to be on a level playing field. So Ian, to your question, while people will always interpret things in their own way, inevitably, because we're all individuals, we do want people to kind of start with a similar, if not the same, understanding of these attributes as much as possible. And we're going to cover that in a little bit more detail, I think, when we talk about framing. People make choices all the time, and we already talked about that. The way that we think about those choices and when we ask people to make choices in a DCE is a little bit different. So we need to make sure that we explain it well, and that can be tricky. I think we've all seen DCEs where that's done poorly, and it means you get poor engagement and people drop out. So we need to do it well. We need to do it as clearly as possible up front. So providing a description of the attributes and their levels as part of that upfront information, even before they've seen a choice task, is really important. I think making those descriptions accessible throughout online, the world of online, is wonderful in being able to use offers and things throughout a survey to allow people to continue to access those definitions if they want to, I think is really important. And we've already touched on this, and that's the importance of having language in these DCEs that's going to be as accessible to the majority of respondents as possible. Sorry, that was a lot. I think, though, that that type of information. So, Ian, we are going to keep talking about this question about information and how it's interpreted and then how it's used when we come back to talk about framing a little bit more. I want to stick with this question about engagement, because we all know that the success of our preference surveys is really dependent on how many people we get to complete them and the quality of the data we get. So, you know, the information and that we provide up front is one way that we can help to facilitate engagement. Kirsten, I'm interested in your experience of how else we might try to improve engagement in choice tasks.
So I think you've already talked about the importance of language, and that really is key. You've also mentioned the idea of hovers, particularly with online, well, obviously only available in online surveys. Can't really hover over a piece of paper. But I think it's also worth thinking about whether there are other visual enhancements that can also help make the choice task more engaging for respondents, or actually even help people understand it better. And I noticed somebody's mentioned in the chat about kind of risk percentages and different ways of presenting numbers. And so you could think about things like the use of pictures or videos. In our example here, we've got, say, for example, the personal wealth attribute, and we've got little pictures there that demonstrate the kind of different size of a candidate's personal wealth. In a choice task that's being used for marketing, where you're being asked about a new product, for example, you might be shown pictures of new packaging, or in a choice about airlines, you might be shown a little video of what the inside of a cabin looks like, those sorts of things as well, which can be useful for engagement, but can also be useful for helping people actually understand the differences in attribute levels as well. So obviously in health, we often present numbers to people. So risks, likelihood of events happening, those sorts of things. So the other thing you might want to think about is whether there are some visual aids that might actually help people understand things like probabilities and risks, and then really understand the differences between those alternatives. So things like icon arrays or dot charts, or icon arrays are where, for example, you have 100 dots and they're coloured to represent the different number of events per 100 people, vertical or horizontal bar charts in different colours to represent the proportion with and without an event, pie charts using words instead of numbers. All of those sorts of things could actually be explored in pilot studies to really try and work out what might be best for your respondent sample. The other thing you could actually do is you could highlight sort of alternating rows of the choice question so that you're really clear about the levels that go with the attribute labels. And there's certainly some designs that vary only some attributes, not all attributes and levels in a question. So you could highlight the rows where the attribute levels have been varied, for example, to kind of highlight that those are the things that have changed between questions. And I think what's really important with any of these kind of things is that they all really need to be well tested in pilot studies to actually really work out what respondents like, but also potentially what really helps respondents understand the numbers, the choice task, the questions, which all kind of goes back to sort of enhancing the reality of the situation as well.
Great.
Long answer. Sorry, Richard.
Perfect.
Yeah, that's really interesting, Kirsten. Thank you. So I just want to move on a little bit. So we've got our attributes and levels, and now we're thinking about how best to describe them in the choice task. And Richard, I wondered what you think about how much attention we need to pay to what people actually see in the tasks.
Yeah,
what do you
this
think?
Is something
Richard?
we've touched on this quite a bit already, and it's something that I'm really quite passionate about, and that's this notion of framing, and that rests on the idea that how we present information, whether it's words, whether it's visual elements like the icon arrays that Kirsten was just referring to, whether it's pictures, that all influences how individuals process information. And that's because when we see information, it might tap into underlying perceptions that we have about that concept, the attribute. It might tap into thoughts that we have already formed on a particular subject, or because we intend that particular picture or that particular word to actually convey a particular interpretation, be it positive or negative, to about an attribute. So thinking about the framing of the information is really important to how individuals might then choose between options. And as much as possible, we don't want that frame to bias how individuals make their choice. To Ian's comment earlier, we know that individuals will always bring their personal frames and their personal lenses to the interpretation of the information. We can't know what that framing is, because that would require that we ask everybody how they interpret every level or for every attribute, and that would be an enormous volume of qualitative information to try and analyze alongside our quantitative information. So what we try to do is minimize how we might bias through framing how individuals are affected by the information we provide in terms of the lenses that we've put on it. So we try to present attributes levels in a way that means that the DCE is going to elicit choices in a way that's not biased. So yes, I'll stop there for that one. Otherwise, I can keep going for a long time.
Well, that's really interesting. Maybe could we just talk about some concrete examples or some other concrete examples, perhaps bringing it back to our case study? What do you think about that?
Well, yeah, okay. So this is a really good one where we could do lots of different things and think about framing. So a nice one would be, we can see that we've got personal wealth there as one of our attributes. And if I'm not looking at the screen and not looking at how we've depicted the levels at the moment, you could immediately, the image that pops into my head is the banker from the board game Monopoly. That's a nice little pictograph that you could have used to depict the level of personal wealth, but that could convey lots of other sorts of information to respondents, and they might interpret that very, very differently. So here, and I'm going to talk a minute about some of those other words that we've used. We also need to think about how respondents perceive colour, and there's a couple of ways to think about this. One is that there's a functional element to how people actually view colour. So some people can't distinguish between certain colours. So if we've used colour to try and distinguish between levels, is that going to work for everybody? And this comes right back to the discussion we had earlier about accessibility. It also comes to framing, because we know that certain colours will convey certain meanings. In some political systems, red and blue have a very specific meaning. Green has a very specific meaning. So if you use those colours, particularly in an example like this, which is about choosing a head of state, what other information are you conveying, and have you accounted for that information when you are then trying to think about your design and your analysis of preferences? And that's really important when we're thinking not only about the setup, but also about the interpretation of our results and what's come out of the DC at the end.
Okay, that sounds like it could cause a whole lot of trouble for the study. Would you not be better off then just using words that describe, for example, in the wealth example, words to describe their socioeconomic class? Are they not then frameless?
It sounds like words could be very appealing, and that we can think about using words to describe population characteristics, something like socio-demographic groups, for example. But people can also react in different ways to those groups and react in a way that we don't necessarily intend. So we also need to think about the meanings that words can carry, and whether or not we might actually want to use something like a number, for example, to convey what we're interested in a less, I'm going to use the word biased, manner. I think using actual numbers rather than labels, and here in our personal wealth, we've used billionaire, less than a million, and million, can be less prone to bias. because those labels, those word labels can, as I said, conjure up all sorts of images. That may not always be bad, that people are bringing those biases, to Ian's point, that people are bringing their pre-existing biases to us. The issue, as I've said, is we don't know what those are, so that when it comes time for us to do our analysis and interpret our results, unless we know how those biases are distributed across our population, we can't account for them in the interpretation of our result. And that makes it very, very difficult for us then to make policy recommendations, if that's what we're doing, on the basis of what we have found. So if I come to this example, we've got another one here about a political affiliation. We might think that using words like moderate, left and right, describing those in that way is going to be frameless, but those words in themselves might carry some information for some individuals, and so we might have to think about other ways that we could describe those particular attributes.
Right.
And
does that mean? Sorry, go on.
Sorry, go on.
No, I was going to say, does that mean that we don't think about framing if we're using numbers as part of our levels?
No, that's me applying my own framing bias. No, numbers are not frameless. We still need to think about framing when we're presenting numbers, because we need to make sure that we're presenting them, using the same metrics, because otherwise we can potentially introduce bias in the way that people will interpret things. So, for example, if we were to present, we've got time as a politician, and if we had someone who had only been a politician for 6 months, and we would actually present that as 6 months rather than 0.5 of a year, that may carry different information to some respondents than if we presented them all on the same metric of years. Similarly, if we were to add another label to that, like only 6 months, that's a clear framing violation, because we're imposing or inferring something is lesser than it is for the other levels. So again, we need to be very careful when we're presenting numbers, that we're presenting them in a way that's not going to lead respondents to a particular choice over others.
Great, thank you. Well, I think unless Richard or Kirsten, you have anything final to add, that about wraps up the sort of conversation that we had proposed to go alongside this. And of course, there's more information on all this in the paper. Matt, you can flick to the final slide if you like now. I hope you've enjoyed the conversation. We've had some really good comments coming in the chat. So many, in fact, that I haven't possibly been able to keep on top of them. So I hope people have had the opportunity to read as we go or to come back to them. And we've got about 5 minutes left to address any burning questions. So while anybody thinks if they would like to sort of come on camera and put a question, or Richard or Kirsten, if there's any questions in the chat that you particularly want to address, there was just one that caught my eye about something I said that I just wanted to sort of go to, and then we can move on to other comments. And that was, I think it was Edward made a comment when we were talking about best presenting more than 2 alternative choice sets and having best worst choices, that going beyond a single choice in a choice set, that if you've got the situation where you've got an opt-out and lots of people opt out, then you may actually have some benefit then in going to having a 2 or more alternative choice sets, so that you make sure you don't just get a lot of choices with a single choice where everyone opts out. And I think that's a really good point to have raised, that is something to consider as well. If Edward wants to come in on that, please feel free to, or if anybody has any questions and they want to jump in, I think perhaps at this point, maybe if you raise your hand and we could go around to questions, or Richard or Kirsten, if you have particular points in the chat you want to address, please jump in.
And I just want to comment on, so Ian, you've asked about the 95% survival rate versus 5% mortality rate. That is a good illustration of what Kahneman and Tversky always use in their prospect theory illustrations as a very, very nice example of framing and how framing can be influential, that whether we frame something in positive or negative language really influences the choices people make. and that you'll find that in the paper. We do talk about that specific example. So a very, very important thing to keep in mind that, you know, the positive or negative language really sways how people make their choices. And anybody who hasn't read Kahneman and Tversky's work, I would highly recommend it. It is seminal work in the framing space.
Yeah, absolutely. I couldn't agree more. I think there's as Richard said, there's also it's mentioned in the paper as well, but there's also some evidence that it not only affects people's choices, but the value you attach to avoiding death versus having somebody live, which conceptually you might think is the same, but if you're doing willingness to pay calculations, you can actually get different values attached to those things that numerically would seem to be the same. So it's a great example of the impact of framing effects on how it can actually influence people's choices.
Okay, we've just got a couple of minutes. Is there anybody who has a burning question that they want to come on camera and speak? Otherwise, if not, I might hand back to Matt to wrap up. And hopefully, if people haven't had the chance to read the comments, they will do at the end, because I think there's some really fabulous comments in there and discussion. Okay, I think we're probably just about bang on time. Thank you for the opportunity to share some of our thoughts with you, and I think we've had a great conversation. Matt, did you want to wrap up, or do we just wind up here?
I'm not going to go on for ages. I'm just going to say thank you very much, Jenny, Richard, and Kirsten. I think it's a great way to present that material in the discussion between the three of you. So just say thanks very much, everyone, for joining. Thank you to our presenters, for IHEA for having us, for IAHPR and the patient for joining up on this collaboration. And I hope that those down under have a good evening, and those in Europe and anywhere in between have a good morning and afternoon. So thanks, folks. We'll wrap up there.
Thanks, everyone.
Thank you.
Thank you. Bye, everyone.
Bye now.
Thanks.
Bye.